There are 5 medications sitting in medicine cabinets across the country that cardiologists are increasingly worried about. What makes this especially concerning is that 3 of them don't even require a prescription. Every day, millions of older adults take these drugs, believing they're safe, either because a doctor once recommended them or because they've used them for years without any noticeable side effects. But what if the harm is happening quietly, in ways you can't feel yet? Recent research suggests that some of the most commonly used medications may actually speed up the very heart problems seniors are trying to prevent. And these aren't rare or obscure drugs. They're among the most frequently prescribed and widely available, found in nearly every pharmacy aisle. This is the kind of information your doctor may not always have time to explain in detail, but it could have a real impact on both your lifespan and your quality of life. I'm Dr. Victor Salinas, and this channel is dedicated to breaking down the latest evidence-based health research into simple, practical guidance, especially for adults over 60. If you haven't subscribed yet, make sure you do so you don't miss important updates like this. We share new, research-backed insights every week. Now, let's take a closer look at these 5 medications, starting with the one experts are calling one of the most overlooked heart risks in older adults today. The first medication on the list is something nearly everyone over 60 has used at some point, and many people take it regularly without a second thought. That's Ibuprofen, commonly sold under brand names like Advil and Motrin, along with its close cousin, Naproxen, known as Aleve. These belong to a class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs, and they're everywhere. Knee pain? Take Ibuprofen. Backache? Reach for Naproxen. The issue is that what feels like simple pain relief may be triggering much more serious effects inside your cardiovascular system. Here's how it works. NSAIDs block an enzyme known as COX-2. When this enzyme is inhibited, your body produces more thromboxane A2, a compound that causes blood vessels to narrow and increases the tendency for blood to clot. At the same time, these medications can lead to fluid retention in the kidneys, which raises blood pressure. A major study published in the British Medical Journal in 2017 analyzed data from over 446,000 patients and found that even 1 week of NSAID use increased the risk of heart attack by 20 to 50%. Not years, just 1 week. For older adults, the risk is even greater. As we age, the kidneys become less efficient at clearing medications from the body. That means NSAIDs stay in your system longer, extending the period of cardiovascular stress every time you take them. If you've been relying on ibuprofen or similar medications whenever joint pain flares up, this is something worth paying serious attention to. The second medication may be even more surprising. Proton pump inhibitors, or PPIs, are among the most commonly prescribed drugs in the country. Around 15 million seniors take them regularly for acid reflux and heartburn. These include medications like omeprazole, Prilosec, and pantoprazole, Protonix. They've been used for decades, and many people take them daily without thinking twice. However, a large study from Stanford University, published in PLOS1, looked at data from nearly 3 million patients and found that people using PPIs had a 16 to 21% higher risk of heart attack compared to those using other treatments for acid reflux. Researchers identified a key reason for this. PPIs reduce levels of an enzyme called DDAH, which plays a crucial role in helping your blood vessels produce nitric oxide. Nitric oxide is essential for keeping arteries relaxed and flexible. When levels drop, arteries become stiffer, leading to higher blood pressure and increased strain on the heart. One patient, Margaret, age 71, came in for a routine checkup after taking omeprazole daily for 9 years. Over the previous 3 years, her blood pressure had been steadily rising, eventually requiring 2 additional medications to control it. No one had linked the issue to her long-term PPI use. After working with her doctor to gradually transition away from the medication and address her reflux through diet and sleep positioning, her blood pressure dropped by 18 points within 4 months. In her case, the medication meant to protect her stomach had quietly been putting extra strain on her heart. The third medication raising serious concern in current cardiac research is one you've likely taken for an infection: fluoroquinolone antibiotics. This group includes ciprofloxacin, commonly known as Cipro, and levofloxacin, sold as Levaquin. These are widely prescribed, especially in older adults, for urinary tract infections and respiratory illnesses. They are highly effective at eliminating bacteria, but they can pose risks to your heart. There are 2 key cardiovascular concerns. First, these antibiotics can prolong what's known as the QT interval on your heart's electrical tracing. In simple terms, they interfere with the timing of your heartbeat, which can lead to dangerous rhythm disturbances. Second, a 2019 study published in the Journal of the American College of Cardiology found a clear association between fluoroquinolone use and an increased risk of aortic aneurysm and aortic dissection, serious conditions where the body's main artery either weakens and bulges or tears. The FDA has even issued specific safety warnings about these risks, particularly for older adults. Have you ever been prescribed Cipro for a urinary tract infection or a chest infection? Share your experience in the comments. I'd like to understand how often this comes up for people watching this channel. The fourth medication is one many seniors pick up themselves without a prescription, simply because it's readily available on pharmacy shelves. That medication is diphenhydramine. You may recognize it as the active ingredient in Benadryl, Tylenol PM, ZzzQuil, and many other over-the-counter sleep aids and allergy medications. Millions of older adults use it regularly, assuming it's safe precisely because it doesn't require a prescription. Here's where the concern lies, especially for heart health. Diphenhydramine is an anticholinergic drug, meaning it blocks a neurotransmitter called acetylcholine. Your heart relies on acetylcholine as a natural braking system. It helps slow your heart rate when needed. When that signal is repeatedly blocked, your heart can remain in a faster-than-normal state, known as tachycardia. Over time, that persistent strain places extra pressure on the heart muscle. A 2015 study published in JAMA Internal Medicine followed nearly 3,500 older adults over 7 years and found that regular use of anticholinergic medications was linked to measurable cumulative cardiovascular harm. For seniors with even mild or borderline heart issues, this kind of ongoing disruption is not something to ignore. The American Geriatric Society has officially included diphenhydramine in its Beers criteria, a list of medications considered potentially inappropriate for adults over 65 due to both cardiovascular and cognitive risks. This isn't a fringe concern. It reflects a broad medical consensus. What stood out most while reviewing the research for this video, however, is the fifth category of medications, those many seniors take to improve their mental health and overall quality of life. Certain antidepressants fall into this group, particularly tricyclic antidepressants like amitriptyline, sold as Elavil, and the SSRI citalopram, known as Celexa. These medications can carry significant cardiac risks that are not always discussed during routine checkups. In fact, The FDA issued a black box warning for citalopram back in 2012 after evidence showed that higher doses could cause dangerous QT interval prolongation, the same type of electrical disturbance seen with fluoroquinolone antibiotics. When the heart's rhythm is disrupted in this way, the consequences can range from noticeable palpitations to life-threatening cardiac events. Tricyclic antidepressants present an even more complex situation. They affect the heart's electrical system through multiple mechanisms at once. Research published in the European Heart Journal found that older adults taking tricyclic antidepressants had significantly higher rates of clinically important arrhythmias compared to those using newer antidepressants. Take Harold, for example. At 76, he had been on amitriptyline for 6 years, originally prescribed for nerve pain rather than depression. During a routine EKG, his cardiologist noticed irregular heart rhythms and asked a simple but crucial question. What medications are you currently taking? When amitriptyline was identified, his healthcare team worked together to gradually transition him to a safer alternative over 8 weeks. Within 3 months, his heart rhythm returned to normal. His cardiologist later told him they had likely prevented a serious cardiac event. Now, here's exactly what you should do with everything you just learned. First, and I want to be absolutely clear, do not stop any prescription medication without speaking to your doctor first. Stopping some of these drugs abruptly can cause serious problems of their own. What you can do right now is this. Write down these 5 categories: NSAIDs, PPIs, fluoroquinolone antibiotics, diphenhydramine, and cardiac-affecting antidepressants. Bring that list to your next appointment and ask your doctor specifically, are any of my current medications in these categories? And if so, is there a safer alternative we should seriously consider? That single question could change your trajectory. For over-the-counter NSAID pain relief, ask your doctor whether acetaminophen, sold as Tylenol, is appropriate for your situation. At standard doses, it does not carry the same cardiovascular risk profile. For acid reflux, there are lifestyle interventions worth trying before or instead of daily PPI use. Elevating the head of your bed 6 to 8 inches, avoiding eating within 3 hours of sleep, and reducing trigger foods like coffee, citrus, and alcohol. These changes can significantly reduce reflux severity while you work with your doctor on a supervised PPI tapering plan, if that's appropriate. For sleep, instead of reaching for diphenhydramine, ask your doctor about cognitive behavioral therapy for insomnia, called CBT-I. Multiple clinical trials have shown CBT-I is more effective than any sleep medication for long-term insomnia, and it carries 0 cardiac risk. Many primary care offices can now refer you directly. For antibiotics, ask your prescribing doctor specifically whether a non-fluoroquinolone option is effective for your infection type. In many cases, equally effective alternatives exist, and your doctor may not routinely consider the switch unless you raise it. The single most important takeaway from everything we covered today is this. Medication safety in seniors is not about avoiding treatment. It's about making sure every pill you take is working for your heart, not quietly working against it. The research is unambiguous that certain widely used drugs carry cardiac risks that deserve a direct conversation between you and your physician. If you found this valuable, leave a comment right now. Comment, "Checking my list," if you're going to bring these 5 medication categories to your next doctor's appointment. Comment your age and whether any of these 5 are something you're currently taking. I genuinely read your responses, and they directly shape what we research and cover next. And if you know someone over 60 who regularly uses Ibuprofen, Prilosec, or Benadryl, consider sharing this and send it to them today. That 5 minutes could matter more than you know. Subscribe to this channel if you haven't already. We translate the research that matters most to your cardiovascular health without the confusion or the fear-mongering. Next week, we're covering the 3 supplements that clinical trials now show can measurably reverse arterial stiffness in adults over 60, the kind of finding that almost never makes it into a standard medical appointment. I'm Dr. Victor Salinas. Your heart deserves this level of attention, and I'll see you in the next video.